Well, that was a great report, and thanks to Sheikh Al-Anizi for her voice, lending us her voice to present the report. And now join me to welcome Mrs. Samah Abdelwahhab, speech therapist, head of rehabilitation department. So welcome to Good Morning Kuwait.
Good morning. I'm happy to be here today.
Well, it's our pleasure, especially that we need to emphasize on the importance of speech therapy and linguistic therapy. And we know that there is a lot of children having difficulties these days, even with the development of media, development of education, but we need to tackle this issue. So based on your let's say experience, how to help children communicate even before they learn how to talk?
Children usually start to communicate at early stages using their eye contact, gestures, pointing, using their facial expressions. We as parents, we should start at the early stages of the child's life to produce language in their daily routines. Label what the child sees or does. Having the child, give him chance to explore things around them.
Yes.
Pause, give the chance to your child to point, to express their needs, to look, to give a gesture.
You said give them the chance, don't rush the child or act on their behalf, just to give them the opportunity to express themselves, whether linguistically or even physically, right?
Yes, because usually parents, what do? They are overprotective,
yes,
conservative. They did things to the child before the child is asking for it. For example, whenever he needs water, they will just grab a bottle of water and give it to their children.
Yes.
So give the child to express, to talk, to look, to give gestures before the age of 1 year. Try always to make your environment full of language, rich language environment. Don't rely on screens, even if the programs are educational ones.
So you said don't depend on, let's say, devices or screens.
Right.
Yes. So based on your also, how common mistakes parents do, as you said, parents depend. Yeah, parents, let's say, depend heavily these days, especially new parents, on gadgets.
Right.
Yes. So we want verbal face-to-face communication with the child. How do parents raise that kind of communication?
Unfortunately, screen time nowadays are easy to access for every child. So what the parents should do is to limit the screen time.
Yes.
And before the age of 2 years, try even not to get them exposed to any screens.
Yes.
Even the educational ones, because this will limit their interaction with the environment. This is the first issue. And one of the main mistakes also the parents can do is talking too fast or giving long sentences.
Yes.
So try to simplify it and slow down. Get to your child's eye level.
Yes.
Repeat. Keep using repetitive language. Try to give the language in simplest way, not in a rushed, complex sentences.
Yes. So just to present, let's say, the daily tasks. So when they are presented to the daily task, they can, let's say, build on that language.
Excellent,
to use it.
Because we always tell, especially working moms, that even if life is so rushed or busy, just assign time per day for your child to read with him. Use the daily routines. Use the bath time, meal time, reading time, sleeping time for your child. This will build language.
Exactly.
Will enrich their vocabulary.
Exactly.
Don't rush. Be a mom, be a dad. Just talk to your child simply.
This is your, let's say, main occupation. You are a mother, you are a father. Just do your job with your children.
Do you know what? Play with your child.
Play with your child.
Play.
Yeah.
Use the play fun. Make speech and language fun.
Yeah, play with your child. As you
play
said,
with
play
your child.
with your
Use
child.
stories. Use communication in their daily routines. Use communication while you are playing with them hide and seek, looking for things around them. This will help a lot in developing language, especially at the early stage of your child.
Exactly. Before even going to kindergarten, that will help a lot. But Mrs. Samah, when do you think that speech delay is normal? We know that there is normal and there is abnormal.
Right.
When it is normal?
Children develop their language milestones at different speeds. You might have your 2 daughters or 2 sons are developing in different speeds. For example, your first child starts to talk at the age of 1 year. Your second child starts to talk at the age of, let's say, 18 months, which is 1.5 years. Both are acquiring the language at early stages and in normal development.
Yes.
When should we say that this is abnormal or they are facing delays in their communication or language milestones? First of all, you have to notice that at the age of 1, your child should respond to his name. He should respond to the environment around him.
Basic, let's say basic orders, no, yes.
He should follow basic orders.
Yes.
They should start to say their first words after the babbling stage. Make sure, please, always to make sure that their hearing thresholds are within normal limits. You need to do hearing tests when you start to face any delays in your children's milestones or children language acquisition.
Yes.
First, you need to check that they hear very well, because we usually acquire language by hearing, by the sense of hearing. Then if we make sure that the hearing level is normal, then we go to the other step, that is building up the level of language milestones. At the age of 1, as I say, they moved from babbling stage to say their first words. At the age of 2, they have to start to produce 2-word sentences.
Yes.
At the age of 3, they need to start producing 3-word sentences.
Yes, let's say simple sentences, simple commands, simple feelings, simple expressions, as they say.
And make sure always the receptive language skills that we build, the expressive language skills on it, is always within normal range. Whenever the mom feels that her child is not developing in a normal range, just please ask for help. Early evaluation will help to prevent any later on, la qadar Allah, God forbidden, language difficulties.
Exactly. Parents sometimes are afraid to seek help because that will put a stigma on their child, that the child is kind of disabled. So please seek help. Now, seeking help, let's talk about therapy. Now you are presented with a case with a child with a speech delay. How do you, let's say, diagnose him or her?
Honestly, we as speech therapists, we don't diagnose, we just assess. So we assess the language milestones of that child. First of all, the child came to the center or to the clinic. We got a full case history, including their development, gross motor development, mental health, if there any something related to speech delay going on through the families. After we take the detailed case history, we go through standardized and unstandardized assessment tests. According to these tests, we seek the gap between the chronological age for this child and his level of language age, the moment that he came to the clinic. If there is a gap, we need to reduce this gap as much as we can. How? By introducing him to mainly books, toys, having rich language environment, giving a good recommendations to the parents to follow at home. The starting point always start at the session. But what happened after the session is the parents' role. We don't ask the parents to be therapists.
To be just parents.
Please be just parents. What you have to do is just follow our recommendations. Weave these techniques that we are using during the sessions.
Let's say overlap what you do and what the parents do. That will put the child or the patient in a confusing status. Who should I follow orders, from the therapist or from my parents? Usually
when things goes naturally, we won't face any confusion. Why? Because especially speech and language development is based on communication, is based on how you are introducing language to your kids. As I said, during their daily living skills, during their daily routines, reading to your child, playing with your child, going out, expose your child to many, to different experiences. This will help child to build their language.
That's amazing.
So again and again, just a parent role is a parent role. Therapist role is a therapist role. So we are the one who teaches the technique, modeling, expanding the child language, parallel talk, self-talk, whatever, what is the name of the technique is. But the parents need to follow the techniques in their daily living.
Daily living.
Daily living.
I have my next question. I know a lot of parents gonna hate me, but it is an important question. Let's talk about bilingualism. We know that a lot of kindergartens or nurseries are now proud of having bilingual curriculums or syllabus or ways of teaching. Is being bilingual or using 2 different languages or 3 with one child can affect their speech development?
Never.
Never.
Unless it's produced in a correct context or in a correct grammar. For example, let's say the mother tongue is Arabic, and all the family around this child is talking in Arabic, and the family starts to introduce English during the first years of this child's life. If you're going to produce it in a correct grammar structural content, this will not affect the child developmental stage. But you should give rich input of that language. For example, if you're giving Arabic language and English language, give it both equally. Try to give it as correct as you can. If you cannot talk in a proper English language, don't do it.
Exactly. If you do not know how to talk properly, leave it aside and focus on one language.
Leave it for the school. Leave it for the people who are trained enough to talk in this language. But the child up to 10 months, let's say, can acquire up to 5 languages.
Well, that's amazing.
But he needs to hear the proper accent from that person who is introducing this language to that child. Plus the family should have the correct grammar, correct structure of that language. And meanwhile, the child can develop all the languages equally, correctly, with a good accent and good structure.
Well, that's amazing.
But again, I always prefer a speech therapist to have the mother tongue language, because this will strengthen the bonding between the family members and will create a culture and identity at the end.
Well, that's amazing. Thank you for joining us, Mrs. Samah, and
I'm
good
so
morning,
happy to be here.
As she said, play with your children, and parents should be parents and therapists should be therapists. And as we reach the end of our show today, thanks to all those who participated with us, whether it was Abdulaziz Ismail, the Dr. Hussein Murad from Kuwait University at Kuwait International Book Fair, Sheikh Al-Anizi for her lovely voice, and of course our lovely crew and the director for his patient. So we bid you farewell and enjoy your day.
Thank you so much.